I'm Veronica. Today I have here my patient, Mr. Dan. He is 55 years old, an engineer. He presented today with a complaint of ear pain, sore throat, increasing shortness of breath, and limited range of motion in the upper extremities. I'm going to begin this procedure by washing my hands. I'll put on my gloves, clean my stethoscope with alcoholic swab, and I'm moving in to introduce myself to the patient and seek consent. Hi, my name is Veronica, and I will be your nurse today. How are you? I'm going to be conducting a physical examination from head to toe in order to establish the general state of your head. Is it okay? Do you want to use the washroom before we get started? No. I'm going to provide you with privacy and cover you with this blanket for comfort. I'm also going to ask you to confirm your date of birth and your last name. Thank you. Beginning with your ears look symmetrical. Your left ear is the same like your right ear, and I don't see any foreign body stuck in your ear or any accumulation of cerumen. I'm going to palpate the auricles and the trachea for any tenderness or pain. Do you feel pains? Yes, that is related to the pain, the ear pain. And I'm going to conduct a whispering test in order to assess for any hearing impairment. I'll ask you to block your left ear, and I'm going to whisper some words in your right ear. 1D7. What did I say? 1D7. Please occlude your left ear, and I'm going to whisper in your right ear. What did I say? 1S5. That shows that the patient does not have any hearing impairment. I'm going to examine your nose. They appear to be on the midline. The color is consistent with the rest of the body, and there is nasal flaring with no crusting, no septal deviation. I'm going to palpate the frontal sinuses and the maxillary sinuses for any sign of acute sinusitis. You should not feel any pain on palpation. Do you feel pains on pressure? No. Next, I'm going to examine your mouth. Your lips appear to be pink and well hydrated. Can you open your mouth? I see your gums are pink and no bleeding. Can I see your teeth? Your teeth appear to be whitish and no sign of dental caries. Can you open your tongue? I'm going to use the tongue depressor to examine the base of the tongue. It appears pink on the midline and no sign of tongue atrophy or abnormal lateral movement of the tongue. And I'm going to examine the upper and the hard and the soft palate. They appear pink and no visible lesions. I'm going to test for glossopharyngeal nerve number 9 and vagus nerve, cranial nerve number 10. I'll ask you to say ah. When you say ah, I notice that the soft palate and the ovular rose, that shows that the two nerves are functional. I'm going to test for cranial nerve number 12, which is the hypoglossal nerve. I'll ask you to stick your tongue out and then roll it from side to side. And then I'm going to say, ask you to repeat after me: light, tight, dynamite. I don't see any tremors. So the hypoglossal nerve is functional. Next, I'm going to examine your neck, and the head is well seated on the neck. I don't see any scars, any lesions, any visible masses, and the color of the neck seems consistent with the rest of the body. And I don't the trachea is on the midline, and there is enlargement of the thyroid gland. I'm going to palpate for any temperature or tenderness. Do you feel pains? No. And I'm going to palpate the radial artery for 30 seconds, the left side, and I'm also going to do same for the right side. The radial pulse is 62 beats per minute. The strength is 2+, and it's equal on both sides. That is a regular, a normal assessment. I'm going to ask the patient, I'm going to test for the spinal accessory nerve, which is cranial nerve number 11. I'll place my hand on your left side, and I'll ask you to rotate your head on the left against the resistance of my hand. And I'm also going to do same on the right side, and I'll ask you to rotate your head, to tilt your head to the right side against the resistance of my hand. The patient did this without any stiffness or pain. That shows that the hypoglossal, the spinal accessory nerve is functional. I'm also going to ask you to shrug your shoulder. the patient is able to shrug his shoulder against my resistance, and that shows that that nerve is functional. I'm going to examine the upper extremities, beginning with your hands. Your left hand is symmetrical to your right hand. That means your left hand is no longer or shorter than your right hand. And I'm going to examine the color of your skin on the hand. It looks consistent with the rest of the body. I don't see any sign of edema or swelling. I don't see any scars or any sign of diaphoresis. And I'm going to palpate the skin for, and I'm going to palpate for joint temperature, joint tenderness, any swelling or any edema. I'm going to feel for muscle bulk, and I'm also going to feel for turgor or elasticity of the skin, and to also test for the hydration of the skin. All this assessment is normal. Next, I'm going to check the nails. It appears pink and capillary refill is less than 3 seconds, which is a normal assessment. I'm going to ask you to flex the fingers, extend the fingers, good. Flex the wrist and extend the wrist, good. Flex the elbow and extend the elbow, fine. Do supination and pronation of the elbow, good. Can you do internal and external rotation of the hand? No. Can you do adduction away and abduction of the hand? No. Can you do internal and external rotation of the hand? No. Can you shrug your shoulders and do abduction and adduction of the hand? No. That shows that the patient has limited range of motion in the upper extremities. Next, I'm going to examine your thorax, and I'll ask you to please take off your shirt so that I can examine your thorax. Thank you. Beginning with the posterior thorax, the shape, the spine is on the midline, and the left side of the back is equal to the right side. The color is consistent with the rest of the body, no visible scars or lesions, and there's no skeletal deformities, and the back is straight, and I don't see any sign of kyphosis, scoliosis, or any barrel shape of the back. I'm going to assess for the transverse section, transverse diameter. This is the diameter from side to side is 2, and the anterior posterior diameter, that is from front to back, is 1. That is a ratio of 2:1 for the anterior posterior transverse ratio, which is a normal assessment. Next, I'm going to test for tactile frematus to feel for the vibration. When I place my hand on your back, say 99, 99, 99, 99. The vibrations are normal. They are not too loud and not too low, and that is a normal assessment of the density of the lungs. I'm going to test for normal symmetrical expansion of the chest wall. I'm going to grab a little bit of adipose tissue below the thoracic cage, and I'll ask the patient to breathe in. When he breathes in, my hands, there's a gap that is created between my hands, and when he breathes out, my fingers return back to normal, which is the normal, an indication of the normal expansion of the chest wall. Next, I'm going to palpate the back to feel for any tenderness, any pain, any lesions, or any swelling, or any deformity or of the back. At this time, there is none. Next, I'm going to use my stethoscope to listen for the lung sounds, the vesicular sounds, which are the vesicular and the bronchovesicular sounds, which are the normal breath sounds. I'm going to place my stethoscope for 1 full minute. For 1 full minute, and I'm going to begin with the vesicular sound from the periphery, which is from the upper part of the back, and then to the middle, which is the bronchovesicular sound, and then I will do this from side to side, from top to bottom. On assessment, the vesicular sounds are low pitch. I got the low pitch vesicular sounds around this on the upper part of the vesicular. They were louder, and in the middle part where I assessed the bronchovesicular sound, I heard some whistling sounds, which in this case are described as adventitious sounds. That could be the reason why the patient has difficulty breathing. Next, I'm going to place the patient in an upright position to assess the anterior thorax. And examining the thorax, the respiration is very fast at 26 beats per minute, and it's not regular. Inspiration is greater than expiration. And I'm going to end my examination at this stage, and I'm going to thank you, Mr. Dan, for your kind cooperation. Bye.